A very good morning to one and all. I am Dr. Vandana Kulkarni from the Department of Anaesthesiology, and today I'll be talking about the role of anesthesiologist as perioperative physician. So, when you know what your role is, you also need to understand your responsibilities. And when you know your responsibilities, you should have the adequate knowledge and skill to fulfill these responsibilities. When you have the knowledge and skill, you can fulfill your responsibilities and then you can perform your role successfully. So, is the role of anesthesiologist only induction of anesthesia, maintenance of anesthesia, and recovery from anesthesia? No, it is not the only responsibility. An anesthesiologist has a very broad and diverse role in patient management. His work is not limited to giving anesthesia only. Anesthesiologists are unique and versatile. They are specialists who are equipped in providing anesthesia across a wide spectrum of ages. That is, they need to cater to ages, to patients who include patients who are premature newborns and patients who are very old or centenarian also. They are also involved in the care of mother and baby, and hence an anesthesiologist is required to know several facets of pediatric, geriatric, and obstetric medicine. Only then he can successfully manage the perioperative events when these patients come for surgery. Anesthesiologists also encounter patients with several deviations from normal physiology. Not all patients who come to the theatre have a normal physiology. They might have some congenital abnormality. For example, you might have a patient who has Down syndrome. So the management of these patients with congenital abnormalities, like they might have some congenital heart disease, we need to understand the implications of these congenital abnormalities in the and their effect in the perioperative outcome. Patient might also have some acquired abnormalities. They might have some comorbid conditions. Commonly, we have patients who come with comorbid conditions like hypertension, diabetes. We need to understand the implications of these conditions on the outcome of the patient. We need to understand whether these comorbid conditions are well controlled, whether they are not controlled, what is the risk associated with the comorbid conditions. We need to understand all these factors. Many times anesthesiologists also have to cater anesthesia to critically ill patients, like patients who have multiple trauma, patients who have infection, sepsis, patients who have malignancy. They might be at their end stage. So we might have to give anesthesia to all these kind of patients. To give anesthesia to these kind of patients who have physiology which is different or deviated from normal physiology, we need to master the etiopathogenesis of these varied conditions. Only when we know the etiology and pathogenesis of these conditions can we understand and then manage the implications of these conditions on anesthesia and surgery. So, an anesthesiologist also needs to have knowledge regarding pharmacodynamics and pharmacokinetics of several drugs which are used for the comorbid or congenital or existing conditions of the patient. There may be some possible interaction of these drugs with the drugs to be used during the perioperative period. Also, these factors, that is the pharmacodynamics and kinetics of the drugs that we are going to use inside the theatre, have an implication on the preference of technique of anesthesia. It helps us understand which drug is to be preferred and which drug is to be avoided. With the advancement in technology, now anesthesiologist has to embark on the use of various advanced gadgets. They have to be well versed with the use of advanced monitoring devices. Previously, when we started, the anesthesiologist was the best monitor. We used to monitor pulse manually, check the BP manually with the use of sphygmomanometer. However, now with changed times, we have advanced monitors. We have multi-para monitors which help us monitor the vitals of the patient. We need to understand how to use these monitors, how to interpret the values. Many times, interpretation of the values requires complicated calculations, which we need to know, which we need to have knowledge about. Also, an anesthesiologist is required to critically analyze the dynamic changes happening inside the body in the perioperative period. So, he needs to understand the use of advanced gadgets like ultrasonography, echocardiography, bispectral index monitoring, and many more such gadgets. So, When we call the anesthesiologist a perioperative physician, we need to understand what perioperative medicine is. Perioperative medicine has been defined as the continuum of patient care involving preoperative evaluation and preparation, pre-anesthetic assessment, intraoperative care, and the management of systems and personnel supporting these activities. So, a perioperative physician, when an anesthesiologist is a perioperative physician, is not merely taking care of the preoperative, intraoperative, and postoperative care of the patient. He's also involving in managing all the systems of the patient as well as controlling and administering the personnel who supports these activities. So, an anesthesiologist is basically a physician who's trained in anesthesia and perioperative medicine. So, what does the role of anesthesiologist basically involve? It involves the care of surgical patients, where in the preoperative period, intraoperative period, as well as postoperative period. So, preoperative period involves the care of the patient before the surgery, intraoperative period involves the care of the patient during surgery, and postoperative care involves the care of the patient after surgery. Preoperative responsibilities of an anesthesiologist generally include medically evaluating the patient before surgery. This starts from history taking. Thorough history taking is important. Also, general physical examination, which involves examination of the patient from head to toe, is required. Systemic examination in detail is also done. That is, examination of the cardiovascular system, respiratory system, central nervous system, per abdomen, all the systems are thoroughly evaluated. After examination of the patient, the investigation of patients are looked into. The required investigations are looked whether they are normal or if they are abnormal, what is the abnormality and what are the implications of this on the surgical outcome of the patient. Also, we need to understand that the airway and examination of the spine is important. Preoperative examination of airway and spine is an important domain in preoperative assessment of the patient because these are the areas which are dealt with by the anesthesiologist inside the theatre for administration of anesthesia. Then let us look into the preoperative preparation. Generally, we can classify them into three aspects, that is psychological preparation, three P's, that is psychological preparation, physical preparation, and pharmacological preparation. What is psychological preparation? We need to comfort, reassure, and make the patient confident prior to the surgery. Then we need to get a valid consent from the patient before he undergoes the surgical procedure. What is physical preparation? We want patients who are clean and hygienic when they come to the theatre. So we instruct the patients so that they come to the theatre with general and oral hygiene. Part preparation is important, not merely surgical part preparation, but also preparation of parts which are dealt with by the anesthesiologist, like preparation of the back, preparation of the arms for insertion of the IV cannula, and preparation of the face, like shaving and all should be looked into. What is pharmacological preparation? We need to understand that many patients are on medications. So whether to continue these medications, whether to stop the medications, whether to add any medications, like we might have to give some anxiolytics, we might have to give some antacids to the patient prior to the surgical procedure. Now coming to the intraoperative responsibilities, continual medical assessment of the patient is important. Monitoring and control of the vital life functions inside the operation theatre is a vital responsibility, important responsibility of the anesthesiologist. So we take care of the IV fluid so as to counter the intraoperative fluid shifts. We take care of the blood transfusion, and of course, control of pain and level of consciousness is very important. So basically, the goal of intraoperative period is to make conditions which are ideal and safe for successful and safe surgery. Now, coming to the postoperative responsibilities, it is important to make sure that the patient is safely transported from the operation theatre to the post-anesthesia care unit. It is also important to take care of the post-operative pain. Monitoring of the vitals in the post-anesthesia care unit should be continued. Intervention and management of acute post-operative emergencies should be taken care of. And of course, discharge of the patient from the post-anesthesia care unit is also decided by the by the anesthesiologist. So, what are the other responsibilities of the anesthesiologist? So, the responsibilities of anesthesiologist are not merely restricted to the operation theatre. He is also involved in the management of patients in the Intensive care unit. Anesthesiologist has an important part to play in the pain clinic also. And of course, catering to anesthesia in the outpatient and remote areas. I hope all of you are clear regarding the role of anesthesiologist as a perioperative physician. Thank you.